This video is one of a series of personal support worker videos that demonstrate the skills needed for the role of the support worker. It is understood that there are multiple ways to carry out these specific demonstrations. The premise of these videos were that we would use skills that are safe, ethical, and also include best practices. We hope you enjoy and, of course, learn something. In this video, providing a brief change to a client while in bed and while standing will be demonstrated. The term adult brief or brief is used instead of diaper. There are several types of adult brief, and in the following demonstrations, the use of a disposable adult brief will be shown. Always check the client's care plan before beginning any procedure. Look for special instructions. In this case, what size of brief the client uses, and if barrier cream is required. Equipment and supplies needed. A clean brief. Gloves. Hand sanitizer. A garbage receptacle. Hamper. Disposable blue pad or towel, PRN. Paper towels. If pericare required, towels, washcloths, soap, and wash basin. Perform hand hygiene before entering the client's room. Knock on the door and greet the client. Place the paper towels on the table before setting down supplies. Identify client according to agency policies. Explain the reason for you being there. Provide privacy. Prepare the bed. Ensure bed breaks are on. Raise the bed to your waist level. Lower the rail. Cover the client with the bath blanket. Have client hold bath sheet and pull bed cover and sheets to the foot of the bed. Perform hand hygiene. Apply gloves. Assist client to move into side-lying position, then place disposable blue pad under client's buttocks. Have client roll over towards you so you can pull the disposable blue pad through onto the other side. Return client to supine position. Pull up bath blanket and client gown to expose adult brief. Undo tabs on brief and fold tabs back onto themselves. Open front flap of brief and fold inwards on itself to contain elimination. Push front flap of brief between the client legs. Assist client to bend knee and lift opposite hip so soiled brief can be tucked under buttocks. Assist client to once again roll into side-lying position away from you for complete removal of soiled brief. Remember, observe contents of the brief and report as needed. Remove gloves and perform hand hygiene. Provide pericare as needed. Pericare always accompanies a brief change and is an important part of personal hygiene and infection control for the client. Please refer to skills video on providing pericare to male or female clients. After performing pericare, remove gloves and perform hand hygiene. Don clean pair of gloves and apply clean brief. It is a good idea to have an extra adult brief on hand in case the tabs break. To apply new brief, assist client to bend leg and to move to a side-lying position away from you. fully open the brief before application. Ensure the back is centered and evenly distributed back to front. Tuck the brief under the back and buttocks. Turn client towards you and bring other side of clean brief and tabs on back. At the same time, roll up the blue pad towards client's back in preparation for removal. Turn client to supine position and front of brief will be brought up through the client's legs. Fasten tabs on brief and ensure elastic of brief around client's legs are not tucked in or constricting. The PSW should be able to slide one finger beneath the elastic around the client's legs. Dispose of soiled blue pad in garbage receptacle. Remove gloves and perform hand hygiene. Cover the client and remove the bath blanket. Raise side rails and lower the bed to its lowest position. Place the call bell within reach. Remove privacy measures. Before leaving the room, gather supplies. No matter the location, it is important for the client to hold on to something while standing. Pre-plan what this will be before you begin, as you want to ensure that the client feels supported and is steady. Examples of what to use for support include, but are not limited to, a grab bar on the wall, a bed rail, back of the chair or walker. And in this demonstration, the client is using a walker to support herself during the brief change. Maneuvering the brief in and around the bars of the walker can be tricky, but as long as the principles of removing the brief and cleaning the peri area from front to back are followed, it's okay. Always check the client's care plan before beginning any procedure. Look for special instructions. In this case, what size of brief the client uses and if barrier cream is required. Check for the description of client's abilities and limitations, as this will determine if you can proceed safely with the client standing during this procedure. Equipment and supplies needed: a clean brief, gloves, hand sanitizer, garbage receptacle, hamper, disposable blue pad or towels PRN, paper towels. If peri-care required, towels, washcloths, soap, and wash basin. Perform hand hygiene before entering the client's room. Knock on the door and greet the client. Enter the room. Identify client according to agency policies. Explain the reason for you being there. Provide privacy. This can be done by either closing the room door and/or drawing the curtains. Keep side table at your side. Ensure the client has non-slip shoes on. The following can be used for a client to hold on to: a chair, side of the bed with railings up, grab bars in the bathroom, or a walker. Don gloves. Help the client to stand. Instruct client to stand with legs slightly apart. And undo tabs of brief and fold tabs back onto themselves. Open front and back tabs of brief and remove brief from front to back. Roll up soiled brief and discard in garbage receptacle. The bag will need to be sealed and removed from the room. Remember, look at contents of brief before discarding. Observe for blood, mucus, and with fecal elimination, note consistency. Remove gloves and perform hand hygiene. Perform appropriate pericare for the situation. Pericare always accompanies a brief change and is an important part of personal hygiene and infection control for the client. Peri-spray is being used in this situation. Please refer to Skills video on providing pericare to male or female clients. Once pericare is provided, remove gloves and perform hand hygiene. Don clean pair of gloves to apply new brief. Fully open brief and fold in half lengthwise. Place the folded brief up between the client's legs. Ensure the tape tabs are at the back of the client. Pull the brief up between the client's legs and up against the perineum, ensuring the back and front flaps are evenly distributed, angling them upwards. Then fasten the top tabs on the brief, angling them downwards. Ensuring elastic of brief or the leg gathers around the legs are not tucked in and constricting. Remove gloves and perform hand hygiene. Help the client to sit. Place the call bell within the client's reach. Remove privacy measures. After all procedures are completed, ensure that you do proper hand hygiene. Ensure also that the client is safe and comfortable by putting the following safety measures in place. Lowering the level of the bed, make sure that the bed rails are up, and providing the client with the call bell. In addition, ensure that all of the privacy measures have been removed. Clean and return equipment to the appropriate places. And lastly, document the care that you have provided, how the client tolerated it, and any observations that you have made.